Have you been treated for vaginal infection and it keeps on coming back, or it keeps on recurring? Today episode I'm going to talk about the reason why the vaginal infection keep on recurring even after being treated. If you are new in this channel, please remember subscribe. My name is Sari. I'm a clinician, and in this channel we always talk about health. So if you are new in this channel, please remember subscribe. Let's talk about the reasons why the vaginal infection keep on recurring. The first reason is buying antibiotics in the chemist, all over-the-counter drugs. Most of people think that vaginal infection is bacterial infection. Most people think that all the vaginal infections, they are caused by bacteria. So in your mind, you just think that when I take antibiotic, I'm going to be cured for my vaginal infection, which is not the case. Not all vaginal infections are caused by bacteria. Some are caused by yeast. So it's very important to go to the hospital rather than going to the chemist and going to pharmacy or a chemist to buy some antibiotics. It's very important to first know what type of the vaginal infection you are having, or do you need the antibiotic. So it's very important that when you have vaginal infection, go to the hospital, go get tested. There are some tests that will get the doctor on which type of antibiotics he or she will give you. There are some tests like microscopic culture and sensitivity. That test will help the doctor to determine the kind of antibiotic that you need or the type of infection that you have. So it's very important. Don't just run to the chemist or pharmacy to go and buy antibiotics. It's very important to go to the hospital, be tested, and let the doctor describe the type of the medication you're supposed to take. Number 2, when you don't complete your medication. Some people, when their symptoms, when the symptoms are being relieved, or the relief of some symptoms, for example, if you're having UTI and you're having maybe burning sensation when urinating, then after maybe you realize that after taking the medication, the symptoms have subsided, or the symptoms are not as severe as they were, then you just decide that I will not take the drugs again. That's very long. You should complete the medication that you are being given by your doctor. So if you are given some antibiotic, please make sure you complete the dosage. If you don't complete the dosage, the infection will just reoccur. After some few days or some few weeks, the infection will reoccur because you didn't complete the medication. So it's very important when you have infection, when you go to the hospital, when you are given some medication, make sure you complete the dosage. Another reason why the vaginal infection keep on recurring or keep on coming back even being treated is when you're being treated alone. Most of the vaginal infection, they are caused by sex. They are transmitted through sex. So when you take medication alone, for example, if you had UTI and your partner, you had sex with your partner, then you go and be treated alone. You are being given maybe some antibiotic, and your partner has not been treated. You complete your dosage, then just go and sleep with your partner again. That UTI will just come back because the partner was not treated. So it's very important to be treated, both parties or both partners. If you have UTI and your partner is well, does not have symptoms, it's very important even him or her to be treated so that you can be treated all together to avoid the recurrence of the infection. So when you have infection and when you have vaginal infection, go with your partner to the hospital so that both of you can be treated for it. Don't just assume that because my partner does not have symptoms, you are good to go. You don't need to take some medicine. It's very important to go to hospital, both of you. And please, that's all I have for today. And please, if you are new to the channel, please remember to subscribe. And if you have subscribed, thank you so much. Bye.